You comment on, I don't know if timing is the right word, but I know that there's been debate in the field about timing of trauma treatment and SUD treatment. The worry being that if I work on trauma first, that creates a vulnerability or that creates a risk that my client's use will increase. And then also, if I don't address the trauma early, I'm not sort of working on some of the reasons that the use exists in the first place.
It's
how would you comment on what
it
clinicians should do when they're dealing with
it's
these
up to
issues?
clients to decide when they want to deal with trauma. My issue with I'm glad let me start with this. I'm glad we recognize trauma as a common causative factor for substance use disorder. Good trauma treatment does not push clients to address their trauma until they're ready. One of the complaints I have about the widespread use of EMDR right now, and I believe EMDR is a very effective tool, just like I like psychedelic therapy. That's what I did. Is that oftentimes what I'm hearing from clients is that their therapist, even though they mean well, pushed them to start dealing with their trauma before they were ready. I think that as EMDR training has become more widespread and in some ways easier, people are going to that tool first and not allowing the client to dictate when they're ready to begin dealing with their trauma, but instead the therapist is pushing it too quickly. I have said that in other PESI trainings. I've been really upfront about it because PESI is a major trainer of EMDR. It is a very powerful tool. It needs to be treated with respect, and it's not the only tool you should have in your toolbox. You know, my literal toolbox out in my shed, I've got a very powerful hammer drill. Okay. I don't use that when I need to hang a picture. And I think that sometimes because we know it's effective, people are turning to that very powerful tool. Just like I had people coming into our clinic wanting to use ketamine. It's a very powerful tool. They weren't it not ready for that yet. It could do more harm than good. And so I think when it comes to trauma, we don't move into dealing with the trauma until the client indicates they're ready. And when it comes to substance use disorder, there has to be an issue of safety. So that, in my opinion, that means there has to be at least some stability. Maybe not complete abstinence, maybe not complete cessation or like, but there has to be a degree of stability before we move into that. And we move slowly and we emphasize the client that if we have to pull back, retract, go back to grounding and safety, that is not a failure. That's a big thing. I cannot emphasize that enough. But again, the powerful trauma tools, if you look at the models as they're designed, make it very clear. We don't begin to address trauma until the person is ready, and we take breaks as needed. I'm
Yeah.
very emphatic about that.